Hello everyone. Today in this video I will be demonstrating few oromotor exercises. In one of the video we have also shown oromotor massage, and I will be posting the link for the video in the description box. And if you are not subscribed to our channel yet, then do subscribe to our channel and support us to do more work in this field. Now I will be demonstrating the oromotor massage with this nuke brush. You can use any brand, and you need to have soft bristles on the brush. I'll say it's level 1 brushing training brush from a kids brand. You will get it from any store, online, offline, so it's fine. And we'll start with the sensory brushing first on the facial aspect with the brush, and I always prefer to go towards the midline. First I'll be doing it outside, then we'll go for the internal oromotor massage and the exercises. Okay, so let's begin. So I always prefer to go from sideways towards midline. Roll the brush, roll the brush, roll the brush. If your child is not familiar with this texture, they will get familiar, they will get prepared for the oromotor massage, and this will also provide them the necessary sensory input as well. When starting for the first time, make sure you are not applying much pressure, and you are not putting pressure so that the child feels it very painful or intolerable. Okay, next I'll be showing the massage inside the mouth. Ask the child to open their mouth. Open it, open it, open it. Okay. Slide the brush under their cheeks and roll it. Roll it. Roll it. And try to roll it downwards, downwards. On the gums, I'm doing it on the gums. The opposite side. Give it for 3 times. Roll it. 1. Relax. Make sure you are not putting so much of pressure. Keep your hand very light. The inner cheek area is very soft. Roll it. And on the gums. Do it for 3 to 4 times. Relax. Repeat it for the second time, and this time I'll be going for the upward gums or the upward gum area. Open your mouth. Okay. Slide the brush very gently and roll it. Roll it upwards. See, it's providing so much of sensory stimulus. Good. This time I am rolling upwards. The brush is rolling upwards. Okay, good. So this was the massage with the brush. Now you can use same brush to stimulate the tongue activities. In the same video, I'll be demonstrating how to do tongue exercises and lip closure exercises as well. If your child has a habit of keeping their mouth open, I'll be demonstrating how to train them for lip closure. Because of muscle weakness, because of the tightness of the muscles surrounding their face, or the weakness, we call it muscular imbalance. Because of that, the child might keep their mouth open, they are not able to close their mouth. Even if child has some breathing issues and they are not having a habit of breathing completely with their nose, they might have a habit of breathing with their mouth also, and that could be the reason that they are keeping their mouth open. So in such cases, we need to provide training for lip closure or mouth closure as well. Plus, we'll be going on for the tongue exercises. I'll be showing it with the brush and then with the other material as well. We'll start with the first exercise, in which I will show you technique to enhance mouth closure. If child has an habit of keeping their mouth open while doing any activity, or if the saliva is dripping down from the corner of their mouth, then you can use this technique. Simply I'm using a small stick like this. You can easily get it from any stationery shop as well. Open your mouth. Now put it just on the lower lip and ask them to close their mouth. Make sure that they are not holding it with their teeth. If they are holding it with their teeth, pull it outside. Pull it out. Again. Close, 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 close. Okay. And at the same time, you can give some activity to be done on a table over here and ask them to hold it, or simply you can count up till 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Give me. Very good. Now try to keep your lips outside. Hold the lips. Let me hold it. Yes. Pull it out, pull it out, pull your lips out. Pull your lips out. Out. No teeth. See, he is trying to hold it with teeth, and I am trying to pull the lips outside. Yes. Good, good, good. That's it. Hold it again. Now, if your child is able to hold the stick like this, what you can do is take 2 coins and secure those 2 coins with a sellotape over here, and then ask the child to hold the stick. These coins will work as added resistance, and this resistance will again help you in strengthening these muscles. So this is one exercise. If you are going to try this exercise, then please do let me know about it in the comment box below. And if you are not subscribed to our channel yet, then please do subscribe to our channel and support us to do more work in this field. Now we'll go on with the second exercise. This is particularly for the tongue one, and this is a smaller stick. You can use honey along with the stick, so that just dip the stick inside honey and do the activity. It will use as a positive reinforcement for your child to do the activities. Here today in the video I am not using the honey at present. Simply I am asking him to take out his tongue and touch on the corner of the stick. But of course you can stick any kind of taste which your child likes on the stick and do it. Now take your tongue out and touch it over here. Open your mouth. Ah. Open it completely. Say ah. Good. Now close it little bit. Good. Now take your tongue out. Touch it. Very good. Take your tongue out in front. Take it out completely. Out. Touch it. Good. Very good. See, he's curling. Slightly. Good. Now do it. Okay. Very good. Very good. Very good. See, the muscles of our face, the muscles surrounding our mouth, they are smaller in size. They can get easily tired. So give frequent breaks in between and begin with lesser repetitions. Gradually increase the number of repetitions. Now, this one was for the tongue. Again, Next exercise, I'll take it as oral praxis. I have made a separate video for oral praxis as well, and I'll be putting the link for that video in the description box below. But over here I am combining it along with the oromotor exercises. See, in oral praxis, child has to copy my facial expressions. So make this. Try to hold the air. Hold it. Yeah, good. So this is one. Another one, he has to make sound like this. Good. Louder. Very good. Now, we'll again use the stick. Now see, open your mouth. See, you have to touch your tongue over here, just behind your teeth. Very good. Now, try to move your jaw. Good. You're moving the tongue along with your jaw. Good. Now, try to clench your teeth. Do like this. E. Make sound. E. Louder. E. Okay. Very good. Now, we'll see the next exercise, in which I'm again using the same stick which we used for mouth closure. In this, I'm going to put the stick directly on the lips of the child, and I'll make a facial expression over here. Child has to copy it. Good. Blow it. Good. Okay. For the next, I'll be again putting it between the lips, and I'll be taking it back. I'll pull it, and I'll make a sound and make expression. Pull it. Very good. Now, if your child is finding it difficult to copy the expressions, or the oral praxis is difficult, then you can always use a mirror to guide your child. You can practice this along with your child in front of a mirror, so child can watch his or her own face along with your face and copy the expression. Few other things that you can use in oromotor exercises are different kinds of straws, and use feathers, thermocol balls, and ask your child to blow it. Blowing is also a good exercise for the oral musculature. Always use different kinds of straws for sucking activities and blowing activities. You can always use whistles and candle blowing as well. So you can use combination of exercises to strengthen this area of face, to improve tone of the muscles and thus enhance speech. Tongue exercises using the brush. You can use some honey, dip the brush in the honey, that will work as a stimulant, and put the brush and ask your child to touch it with their tongue. Try to touch, out, good. The side, front, good. Upward, good. Good. Very good. So these are the exercises for the tongue muscle as well. If you have any queries, then do let us know in the comment box below. Thank you and lots of love to all kids.